So the current status of diabetes in Kenya is very mixed. We have mixed data, prevalence data, ranging from 3 to 6% according to the government estimates. But we do have hotspots of up to 11%, like in the urban areas, Nairobi city, as well as Mukurweni, the Coast province. So we do have hotspot areas as well that we need to watch out for. Urban areas, we do have higher prevalence data. We are having more and more new incident cases of all types of diabetes, especially type 2. Diabetes care has improved. We did not have diabetes educators in Kenya. Along with my colleagues, we started training diabetes educators, and now it is a accepted cadre in Kenya. We have more diabetes educators in private sector as well as in the government. We have had more diabetes specialists coming up in the country and endocrinologists in pediatrics as well as adults. Compared to our other African neighbors, we have guidelines. I was involved in writing the Kenyan diabetes strategy and guidelines together with my colleagues. So we have our guidelines, Kenyan diabetes guidelines and strategy that are followed. And that is something that has changed the landscape of diabetes in this country. We have the state-of-the-art insulin. We have insulin analogs. We have CGM monitoring. We have insulin pumps available. And also, it's not just the type 1 patients. The type 2 patients are using CGM and pumps when needed as well. We have the best medications available. We are also doing precision management of our patients, which gives us good outcomes for our patients and less complications. And we're also getting more data and more research coming out. So in the private sector, anybody can have if they have any complication of diabetes, which they shouldn't really be having, but if they do have it, whether it's a diabetic foot, a heart attack, if they need dialysis, everything is available, and state-of-the-art diabetes management. We have one-stop diabetes clinics in the private sectors as well as the public hospitals. So I'm really happy that there is more equity of care. We trained over 2,000 medical people from across all the medical specialties on diabetes during COVID. So this was a landmark training, and that provided good care in the private sector as well as the government sector during COVID. Patients were consulted with telemedicine. AI, I must say, cannot totally replace medical consultations, but it's made a big difference in terms of training and provision of medical services. We are also having more and more glucometers available for our patients. I think the biggest tool we have really, more than technology, is empowerment and education of our patients. The barriers could be access to specialists, diabetes specialists. So most of the diabetes educators, the endocrinologists, the diabetes specialists are still in Nairobi. So if somebody has a huge problem, they're faced with a challenge, they really have to come to, for example, Nairobi to get a top diabetologist or an endocrinologist. So that's one of the barrier. Another barrier is conflicting messages. So a diabetes specialist might say one thing to a patient, a nutritionist says another thing. There are a lot of alternative things being sold out there, and billboards will advertise them. So in the process, we are having, patients are being misled as well with all these messages. And for patients, it's very, very important to, inform them what's best so that we can have more renal, kidney salvage, heart salvage. Because at the end of the day, it's not the high sugar that messes up the patient. It's the complications of high sugars, high blood pressure, high cholesterol, and miseducation. Not letting the patients know how they get complications. Sometimes patients even have mental health issues, and those are overlooked. Again, availability and accessibility of glucometers, strips, the gadgets that they need to monitor their sugars, education material, access to specialists, whether it's a kidney doctor, a cardiologist, not having the right information at the right time. Sometimes patients are not put on the right medication that they need. We have medications that protect the heart and kidneys, besides lowering the sugars, weight loss, obesity. We really need tailor-made management for each patient. There is so much that can be done, and we're very happy for the partnerships that already exist. The blue circle you see, which is the logo the UN logo for diabetes, we need to make the blue circle wider. If we're having our diabetes walk, if more people can join us in this walk, if we can provide equity across the whole country, because there is no equity. It should not just be the private hospitals or the private patients getting utopian care. I think every Kenyan deserves all the medication, deserves monitoring. So I think if all the partners come together and help us to walk this walk, we are so lucky to be blessed with fruits and vegetables, our agriculture industry. If we can get the messages out so that as Kenyans, we eat healthy, we exercise, lifestyle. If we go back to traditional diets, if these messages, if other partners can help us for healthy lifestyles, type 2 diabetes is preventable, which is 90% of our diabetes. I think we need to stop living in silos, that this is a private hospital, this is a patient with insurance, this is a muheshimiwa. Everybody gets diabetes, whether they're in rural Kenya, urban Kenya, private hospital, general hospital. So as Kenyans, we all need to have these effective partnerships where we are not selfish and we all look out for one another. Responsible media communication can also go a long way. Generally, if you have diabetes, see your doctor, control your sugars, control your blood pressure, control your cholesterol. If you don't have a glucometer, you can go to a pharmacy and check your sugars. But if you can afford a glucometer, spending a little more now will cost you less in the future. If you're not diabetic, don't be like the ostrich that buries its head in the sand. Go and get yourself checked. Well-being is also your mental health, your emotional health, your physical health, your financial health. So look after yourself. It starts with you.